My specific outstanding specialty is men's health andrology, because there are so few around the globe that this is really the one gap that I am most prone to be able to fill. However, it's a concept that I'm developing. It's a concept of looking at a person in a holistic approach, looking at prevention mainly, but A to Z, I call it healthcare, where we say we start at A with just the idea of there might be something wrong, to Z, to maybe even palliative care.
In this episode, I speak to Dr. Karen Czeloth, a global experienced urologist and andrologist who is on a mission to redefine personalized healthcare through a blend of holistic medicine and AI innovation. From her journey across Europe to her work in the United Kingdom, Dr. Czeloth shares how her vision on male health connects to broader health and well-being. We explore how AI is transforming diagnostics, reducing pressure on healthcare systems, and enabling more tailored treatments, while also addressing the real-world challenges and ethical considerations that come with it. I hope this conversation offers you a compelling outlook at the future of medicine, hopefully more personalized, more proactive, and more connected. Sincerely hope you will enjoy my conversation with Dr. Karen Czeloth.
Yes, and we are here with Aberdeen in BioHub. Normally I do these interviews digitally, but today I have with me Dr. Karen Czeloth. And I laugh because we rehearsed the name. And a very interesting story. But let me first start by welcoming you to Pulse. Karen, very happy you could make it.
Thank you very much, and thank you very much for this opportunity.
Yeah, very happy you could make it. Karen, wide range of things, and then you are an andrologist, and I'm sure there's something more that you are that I want to talk about. We were introduced to each other, which was here at a networking event, a breakfast event. We spoke about fertility and infertility because I'm very open about my journey. We spoke about Tina Bio also on this program. Very lovely daughter, and she is the result of 4 IVF attempts over 8 years. My wife was coping with endometriosis, and we spoke long about female health. And then when I told you something in those lines, you said, "Well, have you ever considered that it might have been you?" Right? So. And I think that's a very interesting conversation to have, a male factor infertility, but also beyond that. You do a lot more, but that is also a part of what you specialize in.
Yeah, very much.
Okay.
Very much.
Okay. Yeah.
Very true. So one of the slides that I really try to sneak in every talk I give about the topic is the men is more than just semen.
Yeah.
So in cases like that, I always like to ask, has anybody looked properly at your end? Has anybody looked at anything that could be related to fertility, but actually is a bigger topic to look at to improve your general health and long-term well-being, which I find really the most interesting part maybe of the work with male fertility patients, to really look at what can we do for this person, not only to achieve pregnancy, but beyond that.
Yeah, you have extensive scientific background and also practical background. Let's start there. So you were originally from Germany, even though you find that debatable because you've been in so many places afterwards, but in Germany, it's where it started. Let's agree on that. And so you missed that was that in Germany? So
Yes.
Yeah. And then take me on your journey, because I think that's lovely for the listener also to tap into, like, all the places you went to after Germany.
Yeah. Yes, I am German and born and raised in Germany, and did basically my whole training in Germany as a medical doctor, as a urology specialist.
So for people who are not aware, as I was until 5 minutes ago. Can you explain urology very quickly and then andrology, just so that everyone is on board with
that's a good question, because that is often not very well understood, even in medical circles. So urology deals with all the organs producing urine and below, so kidneys, bladders, prostates, testicles. And then it overlaps with a few things that are sometimes covered from other specialties as well, like the male sexuality, male fertility, things like that. However, andrology is specifically the topic of the male reproductive and beyond function. That was purely male. So what the gynecologist is for the females basically is the andrologist for the males.
Okay, yeah.
And andrology in itself, a clinical andrologist deals with everything specifically men related, and sometimes beyond that, fertility, male sexuality, male specific hormones, then latching into the male general health, medicine expert, basically, is a word that sometimes is being used as well.
Okay. And so you are a clinical andrologist as well. So now we've got the baseline of understanding about what it is that you do, because it's going to get more complicated, right? So you then from Germany.
So born and raised in northern Germany, Kiel. I went to uni and finalized my university studies in Kiel.
Yeah.
And then I worked in different places in Germany. I always followed my career. Whenever there was an interesting next step, I was moving. So I had several places in Germany that I worked at. Then I moved next to, in my uni time, I already spent some time in Spain. And then professionally, I finalized my urology and my andrology training in Germany. And then I moved to Vienna, Austria for a while. And then I moved to Denmark on a scientific scholarship in the andrology center there.
Yeah.
And from then I did a personal step to another country, to the UK, because I met my husband and moved to the UK. So I've quite a few countries and have worked in quite a few different setups. I'm very much translational thinker. So the scientific backgrounds of things were always very important to me. However, not all professional activities were really translational. Some were really basic medical delivery of medical care on a basic level. Most of them, my favorite places were really the translational centers, specifically in andrology, because there are some super centers that can really learn this translation as thinking very well.
And so in the UK, so how long have you been in the UK now?
2018, but I kept on working in Germany for 2 more years. And then I got my license to practice just 3 weeks before COVID lockdown in 2020. So since 2020, I'm working in the UK. I also had a phase of a digital health tech company activity during COVID, where we set up online COVID testing. And now I'm at Aberdeen.
Exciting. Your journey, the reason why I kind of talk about all these places is because you told me a couple of things. You said like, well, I'm interested in helping men better understand their health. It starts with urology and andrology, which is, a very holistic approach. But you also said, I want to do this from an international perspective. And that is kind of what you're trying to do with Aspen. Put something on the map that has an international impact.
Very much, yes. Yeah, that's very true. Yeah, so you've used 2 very important words for me, holistic and international.
Yeah.
Serving for local needs very much, yes, and adjusting to the local system and what it can and can't do. However, always having the eye on the international options and resources, specifically in a very niche field like andrology, where there are not many specialists around the world, really. I definitely want to remain in that network of specialists that I'm in reasonably close contact with ongoingly, to create really something that can stand up just for modern standards. That should, for me, I would not want to just apply local standards, but to really look at what is nowadays reality anywhere in the world and how close can we get there to deliver that sort of.
Yeah, and you see a big role for tech and AI there as well. Yeah.
So AI is, technology, to be fair, technology has been used in so many areas of our lives for so many years, very successfully. Facebook constantly does algorithms about our behavior and serves our needs basically as we expose it to the system. Whereas in medical care, that's not really utilized.
Yeah.
And during COVID, that was very, very much seen as well. We already had a lot of options for home diagnostics and kind of remote testing and remote services, which during a pandemic would have been the way to do.
Yeah.
And still there was a lot of stickiness to old habits and difficulties to adjust to use the technologies available.
Yeah.
So AI for me is a groundbreaking difference as to really making all the knowledge available quickly, 24/7 to anybody who knows how to use it. I mean, AI is, I think, super thrilling, but also to be looked at cautiously in the way that you need to know how to use it, I guess. Lots of people are scared of being replaced, and I definitely think professions really have to rethink what will be our need for the society in the future when AI becomes more established. But still, I think people's knowledge, people's touch on things will be very relevant, and we just have to develop with it. So AI for me is a no-brainer.
Yeah.
And we need to establish it as we can, following regulations and following safeties and being actually critical about it. But yes, apply it where we can.
Yeah. And before we dive into AI and technology, AspenMed and kind of where you are today versus what your ambition is, right? So where you are today is you are a consultant and you work with several patients on a private level, holistic level, better understanding their health and helping them, if need be, with a team of other consultants, right? So you mentioned someone on the fitness end, mentioned the GP, you mentioned nurses. Anyone I'm forgetting?
Nutrition, yeah.
Nutrition. Oh, yeah. Also, these are important things. Take me through how you approach it. So, where does your journey start? A patient knocks on your door.
Yeah. So, patient knocks on my door usually for a topic that is related to my core training.
Yeah.
Makes sense. But then they come up with things in their health history, and I actually do ask for everything. It's about the social and lifestyle that might make sense in the big context. And I, by the way, I'm also trained in sexual medicine, which we didn't mention before, which is an important thing to say, because the more of these trainings I've done, the less I was able to just focus on one urology topic, for instance, because we always treat the person, or I always treat the person. So patient walks in with topic A, and usually topic A is related to topic B, C, D, E, and F. So I cater for whatever I can cater for, but I'm a urologist and andrologist, and I'm a holistic thinker, and I've done lots of trainings just out of curiosity. For instance, half a sports medicine course I've done during my time off between jobs and things like that. But I'm not qualified to deliver sports therapy, or I'm not the GP, things like that. So hence, I work with teams, and I try and find like-minded people who have that holistic approach, who want to work as a team on a case. And that naturally led to some sort of physio, sports therapy, and nutrition. That's a no-brainer. That often is, nearly everybody could improve there through MRBC for whatever. And a GP, obviously, that's kind of where everything can be seen. Cardiology is something that is quite important as well, if you look at the general health. And as an andrologist, for instance, people walking in with erectile dysfunction is very well known to be a predicting factor for later vascular health issues. So we always have that in mind. So somebody walking in with a problem, I try to help them fix the problem to functionality in normal life, but also make them aware of what to be more useful to them than just having that one problem helped with.
This service that you seek to extend in AspenMed, because you're doing this already as a consultant directly, AspenMed would be an extension of this, or more further intensification.
AspenMed is personalized medicine delivered, which naturally has to be a growing team for me. So it was born out of necessity because I basically found myself in a situation where I didn't find a spot to fit in to provide the care that I wanted to provide and that I was able with my training to provide. So hence, out of necessity, a company was set up. And then with patient cases really coming in with certain needs, I needed to find people to join the team to provide for these needs. So, and that will organically grow further. And that depends on where we are, what patient walks through the door, or then with the background perspective, really. So AspenMed is currently a provider of individualized solutions. I like the expression, the best possible care is what we want to deliver. That can be very, very different. If somebody very rich walks in, that can be very different from somebody who's walking in. They have not been seen for sometimes up to 6 years. A very interesting case was they were waiting to be seen for a minor problem for 6 years.
This was in the UK?
Yes.
My.
So 6 years for a problem that for a person in that age is quite relevant, but for the bigger scope of healthcare system is not really relevant. Walked in, I did the diagnostics, and I actually found a bigger problem behind that. That was just showing up with that small kind of influence of lifestyle. Then kind of rolling into all sorts of recommendations. Now that person wasn't in the position with a financial background to do everything private. So I then patched up the gap, sent them back to NHS, but tried to give a real package of, okay, this is a problem. And I'm here to support, but please, NHS, can you take care of it? Which they did. Because once that disease was diagnosed, they knew to go and take it. So the best possible care can be very different. Sometimes it is literally me looking internationally what kind of treatment options as an alternative to what we have locally is available and what is the specific person looking for. And then I like the expression match fitness. So somebody comes in with a certain health challenge that might be cancer diagnosis, that might be upcoming surgery, that might be fertility issues, whatever. And then we define what are their goals, what are their options, and then we try to find the best way around it. But also, I'm being a big believer of using innovation and technology, home diagnostics as much as possible, data tracking. I really, really see big value, having a scientific background and having done proper clinical studies on a bigger scale and worked with big databases. I kind of pull this into clinical work. So I try to encourage my patients to create data as real time as possible for us then to be able to look at, to recognize patterns and to develop algorithms, how to react on patterns that show up in the individual case to then react upon to really prevent things from happening.
I think you're already hinting towards it, but could you just maybe so we're clear as to how you feel AI could accelerate the work that you're doing. And what I thought was interesting is that there's a good way and a bad way, right? You kind of said it's not just because you have AI that everything, all your problems are solved. That's far from the truth. So could you give me a clear example kind of in that trajectory with your patient as to what AI can do for that person going through AspenMed?
Everywhere companies offer biomarker tracking, for instance. So, which is great. I believe in that we should really get more data about our health early in life when we actually don't have any symptoms yet. However, what I often see is there is the availability nowadays to do certain diagnostics that are way beyond the regular national healthcare, for instance, scope. And then people have data that might show up some abnormalities, and then they are a bit lost in where to go with these data to find actually solutions to what they can do. So AI currently then is being used for giving recommendations on this level to what can you do, which is great, which is probably the future and how it can be. However, currently I'm still seeing the big problem that I think AI is still a bit too young to do that. One thing. Second, the data that we have connected until real-time data tracking was really started to be understood is very patchy.
Yeah.
So the current AI is building its knowledge on patchy data and on a big part of actually data that is not quite reliable.
Yeah.
So the AspenMed idea is to use platforms where patients can have the entry point of starting questions. For instance, let's say male fertility. The young man thinks like, oh, I would actually be really interested and know, am I fertile? So what can I do? I can do a little bit of testing myself online or do some, not readily available tests or semen analysis, for instance, at home to a baseline level. I can do some blood result testing online, no problem, without any doctor input. And then something's coming up. Oh, what do I do with that then? So in the Aspen context, we would allow people to self-assess as much as I think it could be done by the person themselves, but then have that team available to be pulled in whenever there is a question really from that patient trying to, or it's a person, it's not a patient in that moment, trying to understand their health. But when everything flags out, where do they go to get discussed, explained, solved, treated? Yeah. That would be then the AspenMed team there as well.
Taking care. Yeah.
Yes. So having an entry point for people where they can self-evaluate to a certain point, but defining at which point it is better to actually get medical advice on that. And then if you have that medical advice, to actually then have the network to know where can I either treat them myself with that problem or send them to specialized centers that we trust. And then meanwhile we do that, help collect the data in a way that it makes sense, help people understand which data actually matters, because a lot of people don't even know, for instance, fertility, that actually lifestyle has a big impact. Yeah. Do I eat properly? Do I exercise properly? Do I overtrain maybe?
Do you sleep enough?
Do you sleep enough? All these patterns can really impact on your fertility.
Yeah.
But how do I improve these things? And what is actually good or bad?
Yeah.
Yeah. So hence the sports scientist, the nutritionist, everybody together looking at this data.
So it's bringing it all together. AI can amplify that we sometimes wonder about. Me being Belgian and British, so I've got a dual nationality. My wife being French and British. But one of the things that concerns us is sometimes the British healthcare system. If you just mentioned an example of 6 years of a waiting list. NHS is a great system. I don't say anything bad about NHS, but it is clearly under strain, right? There's loads going on. There's loads of tension. What are your thoughts around that? So you already have a private approach. So patients approach you privately to get the service that you deliver. How do you see your service rhyming with the system in the UK? And do you think there's any difference if you, for instance, look into Germany?
Yeah. So with me having been in various countries, I've worked as a clinician and or in medical context in 5 countries around Europe and UK. So every system is slightly different, very interesting. The UK system is clearly very generous, as in, that's healthcare for very little money if you compare what people have to pay for their insurance system in Germany. That is very much more. Yeah. Whereas you get it here with little amount of money coming off your taxes. Yeah. So the national healthcare system in the UK clearly is under a strain that is, for me, I'm very curious to see where it will go. Yeah. I think currently it's just the case. It has gaps that it is at the moment not able to fill itself. And what I see as a big difference here to Germany, for instance, in Germany, there's a lot of cross-funding of a public system, but still there's public insurance and private insurance, but they use the same facilities. Doctors are not purely private options. Money from different pots come into the same system. And very often hospitals and clinics are being more funded by private money, of which then the publicly insured definitely benefit from, because they use the same machines and everything. Yeah. Nearly everywhere around the world, healthcare systems are struggling and need to rethink. And I see some problems coming up in Germany, for instance, that I think have been in the UK 15, 20 years ago, maybe. So it's really an interesting one to see how that develops.
Could you give an example? What is it? What is a problem?
Yeah, so waiting lists in Germany are increasing. People wait here for 3 years for an elective surgery or even to be seen by a urologist. They can't believe it. This is just, but still they experience that waiting lists increase, that money's being cut, that they need to reorganize and all sorts. So clearly, resources need to be rethought everywhere. And I think this is again where AI really could help us. That is exactly what it can do. It can funnel information collection that sometimes is being done in a very staggered way. I think we very likely could develop AI supported tools that could reduce the amount of appointments that would be needed for a patient to get better, to maybe third or fourth. From my experience in working in the NHS, I often thought, oh, if I only had this and this information collected before, we could reduce the numbers much. So, for the UK, and I don't work for the NHS right now, which was a conscious decision, because I just believe the kind of medicine that I that I feel I need to deliver in an NHS setting. Just because the restrictions are so heavy for doctors.
There's a lot to think about here and a lot to unpack. I like what you said, like the strain is everywhere, right? It's not, Germany and the UK might be different. If it all ties back to, cutting funds, I just wonder. But I mean, I think the same about education, like all those things, it's so needed, but yet we always think that that's where we need to do budget cuts, right? So that's another conversation, I guess.
But what I find is we now see that people start asking more questions, and I think really since the availability of the internet, Dr. Google, what we had some years ago, now we have Dr. ChatGPT or whatever, or in any topic that is not only medical, as you say, education. The ownership of people for their health is something that I really want to promote. And the whole doing that I do medically is always provide the information that enables the person to understand better actually about their health and hence take ownership of their health in a better way, which I believe is what the socioeconomic thinking needs to do. And
and make it accessible. So to give you an example, I'm going to do a check for prostate cancer on the 7th of May because I'm 46 years old and my father had prostate cancer. He passed in 2024, not of prostate cancer. But I kind of read, and there's the Prostate Cancer UK, they give good information. It's about, me just saying like, hey, I'm that age. I have no symptoms, no nothing, but I want to beat it to the punch, right? So that's kind of what you're doing. Like that level of ownership is something that you need to kind of do, right? Because and Prostate Cancer UK has this great online test, and it asked me 3 questions and said, or you have higher risk, so go check yourself out. Just because my father had it, right? So it's because they say it's genetic. I like the accessibility of it. Of course, I'm not keen to get a test, but I'm like, this is the only way to find out. I'm digging in, right? And that's what I'm excited about. There's so many ways to dig in because of technology, right? It makes it less scary. It makes it more understandable for everyone, and therefore, you can go to people who can help you quicker, but you need to embrace it. That's essentially what you need to do.
That's a very great example, because we actually do know from good studies showing that early testing of PSA, even in your 20s, gives you a long-term vision on your risk of prostate cancer. I mean, now we're having whole genome sequencing and all these modern analysis of much more biomarkers that could give us much more information, which currently is not really being mirrored in sisters because, of course, public funding always needs to kind of counter level and private funding as well, because as said, the best possible care is in every system really what it needs to be looked at. And there's always that risk assessment. How much risk can I accept to have by spending more or less money on testing or treatment or whatever? Also, the other risk of overdiagnosing, of overtreating prostate cancer, super topic for now. because we overtreat and overdiagnose a lot of them.
Yeah.
So it's really that question, who do we actually need to test? Who do we need to treat? Which is then also a change in mindset of people. And hence, really this providing knowledge to people. Yeah. Because having an elevated cancer marker, which PSA, prostate test is, can be very, very scary. So for some people who do not have the understanding deep enough to understand, even if my level is elevated, I shouldn't worry too much, to the extent even if I have a diagnosed cancer, sometimes that doesn't matter for me overall, which is a concept that is very, very difficult to understand for a person who has limited information. And cancer is still a combination of enabling information, but also guiding a patient. And there I see AI very, very useful as well, because good setup AI bots, for instance, specifically trying to give answers that are solid, are there 24/7. Yeah. So how many people in my residency have I seen at 3 o'clock at night because of fear of cancer, and they started Googling and they got really scared they have a tumor, and then they came in for a nibble where you thought, why do you need to come at 3 o'clock in the morning? Because they were so scared and couldn't sleep. So
as you say, you need the right form. You right form of AI, not something that over panics you, but something that guides you essentially.
Exactly, that guides you to not overlook things that shouldn't be overlooked, but also to guide you to be able to be calm about something. And hence, there are lots of strains on the system that can be reduced, and panicking patients is one. Also underdiagnosed patients who weren't caught in the stage of possible prevention, but only when they were actually really sick and then needed long-term medical care, which is extensive. I'm a medical doctor, but I'm also thinking of states funds. And I think we should think in socio-economic terms when we think about healthcare. That can be as good of a citizen as possible.
That brings me to my next question. And then after that, my two very last questions, because I have the feeling we can talk for hours. Already in preparation, we went on many tangents, but we need to focus. You just said humans, right? So you're obviously someone, and that's a compliment, because you have just such vast expertise in something not niche, but like, for men's health. But before we hit recording, you said, I also want to tap into women's health and go beyond there with AspenMed. Can you explain to me how and why?
So the overall idea is to provide personalized health care. So that will be a holistic approach to address an individual's need for intervention or prevention or whatever. My specific outstanding specialty is men's health andrology, because there are so few around the globe that this is really the one gap that I am most prone to be able to fill. However, it's a concept that I'm developing. It's the concept of looking at a person in a holistic approach, looking at prevention mainly, but A to Z, I call it healthcare, where we say you start at A with just the idea of there might be something wrong, to Z, to maybe even palliative care. So all in one house. And when we start that around men's health, which we are doing, we are focusing on men's health mainly currently, but men need a nutritionist, men need a sports therapist, men need a cardiologist anyway. Well, the team that is there already, the same applies for females with maybe slightly different aspects. But the overall concept, the system is the same. We just need a holistic approach to health. And female health, of course, I mean, I'm a female myself. I do see female patients as well in the neurology aspect. Clearly, it's just the same concept.
And you bring in other experts if it were. This has been kind of a wonderful conversation. Your journey with AspenMed is young.
Well, AspenMed is currently more a smaller entity for individuals, and the majority of people come to me through word of mouth. We do have a website, which is aspenmed.net. Where you can find our services. We are delivering for related topics and beyond. we can really provide anybody's services really. We do corporate health as well. So there will be some corporate healthcare programs coming soon.
Yeah.
So that's another to really helping people taking ownership of their health.
Lots of work to be done, because you said, like, I would love to build a center, but it's a floating center. I like the word floating. You said, so you would love to have collaborations with many organizations here. Listener, we are based here with our office on the Forster Hill Health Campus, and I'm looking now at the Institute of Medical Sciences and a big hospital there. So there's loads of health going on here where we are at the moment in Aberdeen. So you're already working with some of them and hope to extend those partnerships,
yes.
Right? Yeah.
So AspenMed is 3 years now.
Yeah.
And a big part of my work was networking, understand the local ins and out whilst keeping old network connections going and treating some patients in between. Yeah. Clearly, there shall be a high standard andrology center in Aberdeen.
Yeah.
And always clearly with an international scope.
Yeah.
And collaborations to anybody who really makes sense. That will be local facilities, local experts, as well as international ones.
Yeah. So the question that I ask every guest that comes on this podcast, I'm fascinated by that personally, routine. And if so, do you care to share?
Yeah, of course. My morning routine has extremely changed over the years. And I think that is probably the thing that I believe is quite important, the ability to pivot in whatever is necessary. So right now, my morning routine is being normally awakened by my barking dog at about 6:15.
Yeah.
Saying that I want to go out.
Yeah.
So that's the first thing. Morning coffee with a latte with turmeric, ginger, and pepper on it, which might be a bit special.
No, it sounds lovely. Yeah.
Lovely, and actually with a bigger nutritional idea behind it.
Yeah.
So I do try to do things that make sense in my overall context for my personal health.
Yeah.
And also in the environment that I'm at. So having dogs and horses at home, they, depending on the season, very much define my start of the day.
Yeah.
But also, of course, when I was in my full-on clinical scientific translational times, there was no time much for morning routine other than falling out of bed and sort of starting with the clinic work. Yeah. But I think what's very important is to have some sort of routines that for me are quite flexible in whenever they occur. So I have certain moments during the day where I find myself doing things. For instance, sitting down at a particular corner of my home with a coffee, looking at what I need to do and what's next, and just letting things sink in and then go further. So for me, over the years, having worked mad hours with no stopping, I now really am at the point time to reflect on a regular basis, ideally several times during the day for just a few minutes.
Yeah. And that helps, it recharges, right?
That helps to recharge, that helps to focus. Specifically, when you try to set up a company, everything seems important and nothing happens if you're not running.
100%.
So that's an interesting experience as a doctor who before was schedule driven.
Yeah.
And had to deliver for deadlines and everything. Now the only one who sets up deadlines is myself.
Yeah.
So that reflection and reset and refocusing is very important.
Yeah. Nice. Wow. This is a great answer. And I see the barking dogs and then the horses that require your attention. So that sounds intense as well, right? Making sure that everyone's fed and happy. That's
intensive, but grounding.
Yeah, grounding as well. Yeah. And then my very last question, any reading you'd like to recommend? Is there anything on your path that you've read studying urology? It's very expert reading and scientific article. You can mention it, but has there been anything that you said, yes, this helped me on my journey, this helped me on my path, that you care to share?
Yes. I'm a sponge, so I pick up information wherever I go. So it's maybe not that easy to define. However, one book that is not too scientific, I think, quite scientific already, but not too scientific, really outlive, deals with the modernization of medicine. some chapters are way too scientific for general public to understand. However, the concept of such a book explaining why we can move from medicine 1.0 to 2 to 3.0, that was actually for me quite interesting. And then the other one, really having talked about AI in medicine, his name now, but AI in medicine really was a thing that I was listening to the audiobook on my way back and forth to weekend shifts down in England, which gave me personally a big push and motivation. Because it outlines the abilities that we will have using AI.
Wonderful recommendations and a wonderful initiative, AspenMed. Thank you so much, Dr. Karen Czeloth, for your time. Thank you so much.
Thank you.
You've listened to Pulse by Alpha Wire, produced by Natalie Piles and Amela Faisal, with great music, The Optimist, written by Holly Hamill, performed and produced by Aldo. Episodes hosted weekly by me, Aldo the Pup.